Hello, PF warriors and all you providers and researchers in the field of pulmonary and interstitial lung disease treatment and research. My name is Shelley Mathis, and I'm Executive Director of the PF Warriors International Support Group. September is Pulmonary Fibrosis Awareness Month, and in recognition of this, we're making this special video presentation with our friends at Veracyte Incorporated, a global diagnostics company that's been working on something very important for the PF community. As we members of the PF community already know, it's very hard to get an accurate diagnosis and an early diagnosis. So Dr. Bill Bullman, Medical Director, Lung Cancer at Veracyte, is joining us today to tell us how all that might be changing. Dr. Bill Bullman has served as Medical Director for Veracyte since 2021. He's been research investigator in multiple clinical trials involving bronchoscopic treatments, lung imaging, and prior to joining Veracyte, Dr. Bullman was Director of Bronchoscopy at Columbia University Medical Center in New York, a position he held for 15 years. He also continues to teach pulmonary medicine to fellows and medical students at the Vagelos College of Physicians and Surgeons. Dr. Bullman graduated from the University of Pennsylvania School of Medicine, where he completed his residency training in internal medicine. He later served as chief resident in medicine and completed fellowship training in pulmonology and critical care at Columbia University. We're so very grateful you joined us today, Dr. Bullman, and tell us why interstitial lung disease, including pulmonary fibrosis, is so hard to diagnose and why the accurate diagnosis is so important.
Well, first, let me just say it's a pleasure to be here. I really do appreciate the opportunity to talk to the PF warriors. Interstitial lung diseases are a very large collection of pulmonary conditions. There are approximately 200 different types of interstitial lung disease, and they can be extremely complex. They can have a variety of manifestations and a variety of symptoms, and those symptoms very often overlap, are very nonspecific and overlap with other perhaps more common conditions. Things like asthma, emphysema, even just obesity can have some of the same symptoms that patients with pulmonary fibrosis of whatever kind experience. And as a consequence, patients are often misdiagnosed with something perhaps more common, and they spend often a long time seeking an accurate treatment as a result of that misdiagnosis. More than half of patients are misdiagnosed with some other, typically pulmonary or cardiac condition, before they actually get a pulmonary fibrosis diagnosis or an interstitial lung disease diagnosis. Pulmonary fibrosis is one of the types of interstitial lung diseases, but it is the most common of the interstitial lung diseases. And in particular, idiopathic pulmonary fibrosis, or IPF, is the most common of the progressive fibrotic diseases. And because of this overlap with other disease conditions, because the diseases themselves are quite complicated, it is not uncommon for patients to really struggle to get an accurate diagnosis. There are treatments for pulmonary fibrosis, particularly the progressive pulmonary fibrosis, including IPF. And getting on those treatments sooner rather than later is just absolutely essential to prevent a loss of lung function that, once it's lost, can be irreversible in some patients.
Thank you. And as a caregiver of a pulmonary fibrosis patient, it took my husband, I don't know, 4 or 5 years to get the right diagnosis, being treated for asthma and then different allergies and finally pulmonary fibrosis.
That disease journey is just so incredibly common. Most people with pulmonary fibrosis have a very chronic course and a slow progression, and they present with things like cough or feeling short of breath. Those are symptoms of many, many different pulmonary and cardiac conditions. And so, yeah, it's a struggle for more patients than not.
I would say 90%, but that's just what we're hearing on our from our community. Why is usual interstitial pneumonia important for suspected interstitial lung diseases, or ILD?
Yeah, one of the things that makes the interstitial lung diseases very confusing for patients and for doctors is there are a lot of acronyms, and they get used sometimes out of context, and they can be quite confusing. The interstitial lung diseases, or the ILDs, are just a change in the actual tissue of the lungs. The lungs are normally very soft and spongy, and they're very compliant. They open and close, they expand and contract very, very easily. The interstitial diseases cause a loss of that sponginess, that elasticity of the lungs. The lungs become stiff, and it makes them it can make it difficult to breathe. The pulmonary fibrotic diseases are diseases that cause scarring in that tissue, that soft tissue of the lungs. And there are a wide range of pulmonary fibrotic diseases, some progressive, some not, some related to things that patients inhale, some not, some related to inflammation in the lungs, some not. Idiopathic pulmonary fibrosis, or IPF, is the clinical disease, or condition that we use to describe this scarring of the lungs where we don't know the cause. When you look at a patient with IPF and you look at their lungs under a microscope, what you see is this process of scarring that has been called UIP, or usual interstitial pneumonia. That's a confusing term for patients because it's not the type of pneumonia that you hear about people getting. It's not the infectious pneumonia where you get a patch of bacterial infection in one lung or both lungs. It's not like COVID pneumonia where your lungs become very inflamed with this virus. It is a process that is fundamentally nothing inflamed in lungs, but just fibrosis or scarring of the lung tissue. And it's insidious. It happens over a long period of time. It happens very mild at first, and then can get quite severe. But identifying patients who have usual interstitial pneumonia, that's the foundational pathology in their lungs, is really important because we do, as I mentioned, have two excellent treatments that stop the progression of this fibrotic process. There are some patients where you can look at their CAT scan. Almost every patient with pulmonary fibrosis has had a CAT scan at some point. There are some patients where you can look at the CAT scan and say, oh, I see a pattern that looks like a UIP pattern. And those patients, you can say, oh, if they have the right symptoms and they don't have anything else that's causing their lung scarring, you can say, I see clear UIP, and I can call this condition that this person has IPF, idiopathic pulmonary fibrosis. You do a huge workup often to rule out many other things, and you settle on this diagnosis of IPF. Well, that actually is the minority of patients. Most patients don't read the textbook. Most patients don't have classic findings or all of the symptoms of a particular condition. And as a consequence, it can be really, really hard and take a very long time to make this diagnosis. UIP, to make it even more confusing for some folks perhaps, is also the basic underlying pathology in other conditions as well. The Envisia classifier, which we'll talk about, was a test specifically developed for those patients who aren't classic UIP, where we can say, without doing much at all, just looking at their history and their physical and their laboratory testing and their CAT scan, and call them IPF. For those patients that we can't do that, a doctor can't make that clear diagnosis, the Envisia classifier can certainly help.
So exactly what is the Envisia genomic classifier?
The Envisia genomic classifier is a test that uses genetic information obtained from very tiny pieces of lung tissue that a pulmonologist can collect during a procedure called a bronchoscopy. They take 3 to 5 small samples. It's done while the person's asleep. It's done in a minimally invasive way. There's no surgery. The classifier itself takes a look at the information in 190 different genes, and that helps inform whether the individual has this usual interstitial pneumonia or not. The results come back as UIP positive or UIP negative, and those results take about 2 weeks. and it helps the physician taking care of the individual determine exactly what the best treatment for their pulmonary fibrotic process is.
I've heard from people in our community that getting that biopsy is very hard to get over. I don't know exactly, what the problems are, but they say, not only does it hurt, but it's really hard to heal, and it causes other problems.
Yeah, the surgical lung biopsy is one of the more invasive ways in which you can get lung tissue. There's another procedure called cryobiopsy that is, again, a more invasive bronchoscopic procedure than the biopsy that we take, what's called a transbronchial biopsy that we take for the Envisia classifier. I just have a very simple picture to share with your team and the PF warriors. This is a picture of essentially what a bronchoscopy looks like. This is a cartoon of lungs. The airways, or your bronchial tubes, go out into the tissue of your lungs, and the bronchoscope is inserted into a person's lungs, again, while they're asleep, through their nose, sometimes through the mouth, and a very, very tiny tool called the forceps takes very, very tiny bites of lung tissue, typically 3 to 5 bites. Each of those biopsy samples is about the size of the head of a pin, maybe just a slightly bit bigger, and that gives us enough information to run the information on those 190 genes that go into the Envisia classifier, and tells us in some patients that they have this underlying UIP, this usual interstitial pneumonia. And again, that's critically important to make sure that the right patients get put on the right medications to treat their pulmonary fibrosis. And that's why it's, I think, important for patients to understand that particular terminology, in addition to the other labels that are used for various pulmonary fibrotic conditions.
I think that's going to be something our community is going to be very interested in, but exactly who is the ideal candidate for this classifier testing?
So the ideal candidate is an individual who has no clear diagnosis of what their pulmonary fibrotic process is. In general, an individual will have gotten to see a pulmonologist, hopefully to evaluate their symptoms. That pulmonologist will have done a very thorough physical examination, a very thorough history taking. They will have reviewed all of the potential exposures that could lead to pulmonary fibrosis. Asbestos is the most common one, but silicates, a variety of other things that are in the air, particles that you can inhale and lead to a fibrotic reaction in your lungs. Once the doctor has safely, he or she has safely ruled out those other causes, they'll do a battery of blood tests where they'll look for other things that could cause pulmonary fibrosis, notably some of the autoimmune conditions that can be associated with pulmonary fibrosis. And if the physician, the doctor seeing the person, has not yet been able to make a clear diagnosis, they will either review or order a high-resolution CAT scan, and that information may allow them to make a confident diagnosis of a pulmonary fibrotic disease or pulmonary fibrotic condition. If they are not able to do that confidently, if there is still uncertainty after all that extensive workup, that's where the Envisia classifier comes in. The Envisia classifier is going to be done by a pulmonologist who performs bronchoscopy. That's not always the lung doctor who's seeing a person with pulmonary fibrosis. There are actually two separate specialties. I was a bronchoscopist. I did not typically care for patients with interstitial lung disease, but I certainly saw them very, very frequently, and then referred them to my colleagues, the experts in interstitial lung disease. So the doctor, pulmonologist who takes care of patients with fibrosis, may recommend that you see a different pulmonologist to get this biopsy done, and then together they'll work together to make hopefully a confident diagnosis in the context of the Envisia results.
Excellent. That's so wonderful to learn. And I'm curious, what kind of data have you been looking at that really supports all this that you can share with us?
So the Envisia classifier was developed a number of years ago, and the test was clinically validated in a series of papers sponsored by Veracyte, and then done by actual users of the test. There have been 4 large studies and that have published and they show very consistent results. The test was very specifically designed to have what's called high specificity. That means when it gives a report of this person has UIP, you can be very confident in that result. That's the specificity of the test. And it is on this very recent paper that came out called a systematic review, where they look at all of the data on the Envisia classifier. That specificity was 92%. So when you get an Envisia UIP positive result, you can have very high level confidence that that is accurately telling you what's going on in that individual person.
This is great news for the pulmonary fibrosis patients. Just out of curiosity, how many other diseases have you been able to diagnose? For example, lung cancer, I guess, would have been one of the easy ones, or type of lung cancer, or what others?
Yeah, there's, like I said, there are 200 of the interstitial lung diseases alone, and we do bronchoscopy to try and make a diagnosis in those. The Envisia classifier is designed to identify UIP in patients who have idiopathic pulmonary fibrosis, but also with other lung conditions. There's another lung condition called chronic hypersensitivity. That's basically an allergic reaction to something in an individual's environment that's causing them to develop some either inflammation or fibrosis or both. And that is unfortunately another less common than IPF, but another very common pulmonary condition. In bronchoscopy, we diagnose a full range of interstitial lung diseases, with including a condition that some of your PF warriors may have called sarcoidosis. Sarcoidosis is a very personal condition for me, because my mother had sarcoidosis. It is a disease mostly of inflammation in the lungs, but it can cause very enlarged lymph nodes in the lungs, can cause scarring in the lungs. And I'm happy to say that although she was misdiagnosed with another lung condition for a very long, scary lung condition for a very long time, she got treatment for her sarcoidosis, and that was 50 something years ago, and she is alive and well at the age of 80 something, I think. I won't share, just in case she watches this video. But and you're absolutely right. We use bronchoscopy also to diagnose and stage lung cancer. Our goals as pulmonologists are to find these, like idiopathic pulmonary fibrosis, to find all of these lung conditions and make an accurate diagnosis early enough to make an intervention that's going to have a meaningful improvement in a person's quality of life and hopefully quantity of life as well.
Oh, that is such good news for us. So where can our audience go to find more information about the Envisia genomic classifier and Veracyte?
Anyone interested in learning more can go to the veracyte.com website. The website is veracyte.com/lung. It's veracyte.com. And anyone can put in their name. This is for individuals with pulmonary fibrosis, this is for caregivers, this is for physicians. There's information on the site for everyone. Put in your name, your email, and your zip code, so that the customer service department at Veracyte can identify a place near you where you can get the testing done. And that you can ask for your doctor to go to that same website as well. There's information for physicians there. And certainly any physician who has specific questions about the data around the Envisia classifier, they're welcome to reach out to me directly. I'm happy to have a peer-to-peer, physician-to-physician discussion to help not just individuals with pulmonary fibrosis, but their caregivers and doctors understand what this classifier can do.
Dr. Buhlman, thank you so much for this wonderful information, and I hope Veracyte will send you to every seminar and convention that primary care physicians are doing nowadays, because it is such important work, and early detection, early diagnosis of the right form of PF is going to make a big difference in a lot of lives.
I think you're absolutely correct. The idea that we need to continue to educate our primary care providers to recognize the sometimes subtle signs of a pulmonary fibrotic disease, something as simple as reintroducing them to the sounds that sometimes patients with or individuals with pulmonary fibrosis have when a doctor listens with a stethoscope to their lungs. There's some very simple ways in which physicians can better educate themselves, and how pulmonologists can educate primary care providers better to recognize these diseases early. It's absolutely critical treatment started as soon as possible, again, to prevent decline in lung function over time that may not be reversible even with the best medicines that we have. That's not to say that every pulmonary fibrotic process is a necessarily a progressive disease. That's not to say that there aren't cases of lung function loss that can be reversed. It's just absolutely critical in all of these conditions that we find what's going on as soon as possible and get people on the right treatments.
Excellent information. And thank you again so much. And thank all of you listeners too for joining us today. For more information like this, be sure to go to www.pfwarriors.com. Thanks so much and goodbye.